Hey, what's up guys? Welcome back to the channel. Today we're going to talk about Saquon Barkley's ankle injury that happened just this past week, what the mechanism of injury was, the anatomy behind it, and what the rehab timeline looks like for the New York Giants running back. If this is your first time on my channel, my name is Jin. I'm a third-year physical therapy student and I post every week on my life in physical therapy school and just about anything related to physical therapy. So if that sounds like something that's interesting to you, please consider subscribing and hitting the notification button. All right, so let's take a look at Saquon Barkley's injury here. You can see that the injury occurred away from where the ball was, and you can see that Saquon kind of steps on this Cowboys defender's foot, and that really inverts his ankle way past its normal range. You can also see that his foot is plantar flexed, meaning the heel is off the ground and the toes are pointing towards the ground because he is stepping on the Cowboys defender's foot. So with this kind of mechanism of injury, we can suspect a sprain of one of the ligaments on the lateral side of the ankle because it was an inversion injury. And out of all those ligaments on the lateral side of the ankle, we can kind of narrow it down to this one ligament called ATFL, which stands for anterior talofibular ligament, because number one, ATFL is one of the most commonly injured ligament when athletes or patients experience a low ankle sprain with an inversion injury, and number two, because ATFL is supposed to resist inversion with the ankle and plantar flexion, which was the case in Saquon Barkley's injury. So depending on how much the ligament got pulled during the injury, we can give an estimate of the return to play timeline for Saquon Barkley. So grade 1 sprain of a ligament would typically look like a mild tear potentially, and your ankle being a little sore, which doesn't seem to be the case here. Grade 2, obviously a little more severe with a moderate, possibly a moderate tear of the ligament, and definitely more swollen than grade 1 ligament sprain. And grade 3, it's possible that you might actually hear the popping sound, and there's definitely going to be some more pain and more swelling, as well as a full tear of the ligament. So now let's talk about the whole rehab process, what that would generally look like. One of the very first things that we need to do is make sure there are no fractures involved. Avulsion fractures could be common, possibly depending on how much the ligament was pulled at its attachment site on the bone. And of course we need to look out for any other fractures around the ankle joint, because that would completely change up the rehab process for Barkley. But since there has been no additional reports on the media on potential fractures, we're going to assume that this injury is a grade 2 or a grade 3 low ankle sprain, and let's discuss the physical therapy or rehab process. For the sake of simplicity, I divided the rehab process into an acute phase, which is earlier, and strengthening phase, which is later. So like I said, the acute phase would come first. In this stage, we're trying to minimize the pain, minimize the swelling. In order to minimize swelling, you can use your good old RICE method, rest, ice, compression, elevation, and whatever we have to do in order to get that range of motion back at the ankle. And once we get the pain under control, the inflammation under control, get the range of motion back, get swelling under control, we can start to go about the strengthening phase. A good starting point for strengthening would be isometric exercises, where we are not varying the length of the muscle during the exercise. And so in isometric exercises, our muscles are going to stay relatively stiff and it won't usually change in length. So in very broad terms, we have 3 main muscle groups that are responsible for taking the ankle into inversion and eversion and pretty much keeping it stable and preventing these injuries from happening. And those 3 muscle groups are, number 1, anterior tibialis, which is responsible for up and in, so dorsiflexion and inversion, fibularis longus and brevis, which does the completely opposite action, which is plantar flexion and eversion, down and out. And finally, we have posterior tibialis, which is responsible for down and in, so plantar flexion and inversion. So in the very beginning of the strengthening phase, I would like to isometrically work these muscle groups and progressively challenge Saquon Barkley if I ever work with him, hypothetically. And then with the challenging part, you can challenge him by getting him into a single leg stance or loading the ankle more by adding weights like dumbbells and kettlebells. I would like to focus on the isometric component of strengthening, move on to the eccentric portion, give him some more resistance, load it more, and finally work on some push-off power or concentric power exercises in order to successfully set him up for success. Sorry, I said success twice there, but in order to set him up for success when it comes to meeting the demands of playing in the NFL as the running back for the Giants. And so that is it for today. I hope you guys enjoyed this video. I enjoyed making it. I enjoyed watching Saquon play, even as a Washington fan. So I hope he comes back soon, healthier than before, and I'll see you guys next week.